Okay, going live. Oh, perfect. We're joining, I think.
Hi.
Perfect.
Yay.
Hi.
How are you doing?
Good. How are you? It's good to see you.
Good. Yeah, you too.
All right. So you're open right now. How's your family? How are your patients? How are
Um,
you? Healthy and safe?
family's good. Yes, I think just about everybody in my family is like 100% quarantined, you know, not really even going to the grocery store. I'm the oddball that's going out into the world, and um, I'm doing good, fortunately. And then patients are doing well, the ones that are coming in, and the people that have decided to stay home and reach out to me, or if I've reached out to them. Everybody's staying safe, which is good.
Yeah.
Um, yeah.
Okay. Well, I know like a lot of our colleagues did close down or, had to completely go to telemedicine.
Yeah.
It's kind of different in every state, right? Like we're both in
Right.
California, like
Hmm.
acupuncture. So, we're considered primary care, we're considered
Yep.
essential health care. Um, Florida, for example, everything that was non-emergency got shut down. And
Yeah.
that was
New
also
York.
strange because then beaches reopened. And so it's really a different situation everywhere you go. But California, we did, we were able to continue to see patients. So you've been open the entire time, right?
Correct. Yes.
Not at all.
Yeah, I never shut down. And early on, especially after the governor came out with this shelter in place order for the whole state, I questioned myself every single day. Like, am I doing the right thing? Um, doing good by everybody else. And every day the answer was yes, I'm doing the right thing because people were still coming in and clearly the medicine was needed. So I have reduced my hours just by, requirement because I think you were on a live the other day and I heard you say that, your patient population has gone down significantly. And I think that's the case for all of us who have remained open.
Mm-hmm.
Um, but even with, the reduced hours and whatnot, people that I do have coming in have just expressed so much gratitude for
Yeah.
me being there for them because they're in pain and they maybe don't have another place to turn, or everybody's anxiety and stress is a little excessive these days.
Right.
And that 30 minutes on the table is like the only 30 minutes of relief that they're getting in a week. So I'm pretty happy that I was able to stay open and that we are in California and
Yeah.
weren't shut down like a lot of the other states were.
Yeah. My population definitely went down, and some switched to telemedicine because I had people who didn't even quarantine here in LA. Like they, had an option to go elsewhere, or they had kind of self quarantined themselves earlier than even the
Right.
stay at home. So, yeah, if I, normally I'm in the office 4 or 5 days a week, I'm in once to twice,
Mhm.
and then telemedicine on other days. But, I had the same experience you did, where it's like every single day when the stay-at-home order started, I had to like check in and be like, okay, I feel like this is really needed right now. I want
Yeah.
to make sure I'm making this decision for me and I'm making the right decision for my patient population and for
Mhm.
people who, need to continue to get care. And that also kind of transformed as time went on. I saw people get more willing to do telemedicine as time went on. Initially, it was people were like, I'm just going to wait, maybe it'll be like a week or two.
Mhm.
And then this started going longer. and people couldn't come in, they're like, okay, well, I actually need to figure out this telemedicine situation.
Right.
And now I had, people who may have quarantined elsewhere who are starting to come back to LA who are like, okay, I really want to get in. But like you mentioned, the stress and anxiety component, like that was something that like I'm treating more now. It's very different now than it was before. I was like, okay, this is people who are engaging in like an unsustainable, fast-paced lifestyle. I don't know when this is gonna, we need a break. Like I need like a lot of my patients, I was like, man, if they just took a little bit of time off, I think so many of their symptoms would go away. And then it was like the forced time off, and then it was the stress and anxiety that goes around that. So also happy that I stayed open and left, that decision up to patients and just continue to educate them on the options that are there. But how has it been for you with telemedicine? Like, was that something that you had done before? Did you initially, like roll that out right away? What was your experience with that like?
So I did not do telemedicine before, although I'm really trying to look at the silver lining of this whole situation. And personally, for me, this has one forced me, and I think everybody else in our profession and many other, very manual, hands-on professions, to think outside the box. And for myself, I came up with a couple of, I think really ideas to help people that are home. And then I know many of our colleagues were coming up with great ideas that I was kind of pulling from. Um, so I did zero telemedicine before, with the exception of, maybe a couple like herbal consults here and there for friends and family that live outside my area. But generally, I did nothing. And I've actually not transitioned to much telemedicine even now. I've not been able to get my patients who are choosing to stay at home to, I don't know if they're just not seeing the value in it, or they're just waiting. They'd rather just lay on the table. But I have done a couple of group acupuncture sessions virtually where I teach people about, maybe 10-ish points and just general balancing points that everybody could use, and then stress reduction points. And I've gotten great feedback with that. So I'm kind of transitioning more to companies basically that, they're all working from home now, and the employers want to support their employees. And it's like, not only are you working full time from home, you're probably also a parent who's trying to now be a teacher. And it's like, life is just hard. And so I've had some employers reach out to me and, say, hey, we want to offer the group acupuncture to our employees. And so working through that and doing that virtually, and that's been really fun for me. Gotten a lot of great feedback with people doing acupressure, and I can teach them, just yin tong or ear shed men, and they get back, and the feedback I'm getting is, if I do that point on my ear, if I rub it, it really calms me down. So it definitely is effective.
I love the group approach that you're taking. I've done that in person, like community type setups and gone to different companies, but I hadn't even thought about that from a telemedicine perspective. But it's perfect because everybody's already virtual. They're already at home. They're already in a place where they have the time and space to do that. And it's an additional, value that a corporation could be offering to their employees that are, having a hard time right now with this whole pivot. With my telemedicine, it's been only one-on-one. What I've been really pleasantly surprised with is the new patient consults. Because even people who are going to come into the office, I transitioned to doing the initial intake new patient consult virtually. And then when they come in just for the acupuncture. And the reason I did that was, one, because, you know, initially it was very scary with COVID and we didn't know what the situation was. And there's so many things that had to change in my office. Like, I'm wearing a mask and gloves. It's not a great personal connection with someone that you've, you know, never met before. So I wanted to do those initial consults online, and then also be able to screen people, make sure they don't have any symptoms, all of that. But I found it to be like very personable. Like, it's really not bad at all. You know, there's still like palpation and things that, you know, we do in office that I wish I could do on that initial, but having someone send me a picture of their tongue and then being able to just have a one-on-one conversation, and also kind of like minimizes a lot of the distractions too. I've seen that it's almost like a more streamlined process.
Interesting. Yeah.
Yeah, so it's been really interesting to see that. But I think, you know, people are starting to get used to the idea that you can connect in this way, and it doesn't seem, you know, as hands off or foreign. It's just like, okay, this is what we're doing now. And I think in our industry, in our profession, there's still this like, oh, well, I'll just wait, you know, until things reopen to figure it out. But I think what we're often not thinking about is that there's going to be this expectation, I think, on the part of patients, just like in healthcare ongoing, that even if that's not your only option to do virtual, that there is an option. Um, and so like getting comfortable with the idea of that setup now and implementing it into practice, I think is really important, because I don't think it's something that's going away. I think it's just something that we've really had to talk about now, and it's going to be the expectation moving forward.
Right. I completely agree with you. So I haven't gone quite as far as you have. So my any new patients I've been seeing, I am still doing my general intake in the office like I normally would, because just like you said, like I love that one-on-one connection that I get with my patients. Um, that's really interesting. I might want to give that a try. Although I do think that we're starting to get to the end of the stay-at-home order. Hopefully, please, let's be able to act again. Um, but I may start implementing that, doing the initial consult virtually and then having them come in. I do kind of like that idea. I have been wearing a mask and my lab coat, which I wouldn't normally wear my lab coat in the office anymore since we graduated from school and we're so. But I have been wearing a mask and my lab coat, but I have not been wearing gloves when I'm actually working on the patient. Of course, you know, I'm washing my hands multiple times before and after touching them. But for me to find the points, it's so much in my hands and so much of the feel. And then I also think that we're so deprived right now of physical touch. And
Yes.
think I do think that it's great that us as a society and as a planet have been able to pivot and use these tools to virtually connect with the ones we love. But at the same time, we're still not getting that physical touch, like actually being able to hug our friends and family. And for those people, and I know like quite a few of my patients that are still coming in are single and they don't live with family and they're completely isolated with the exception of probably coming to see me. And so it might be the only physical touch that they're getting during the week. And so I do still think that, you know, being able to place my hand on somebody's leg is just to even find the point is probably therapeutic for people right now.
Yeah, I would agree with that. I mean, there's that like transfer. I mean, it's the reason that when I try to do acupuncture on myself, it does not have the same effect as when someone is doing it for me. So,
Right.
yeah, which I'm going to get acupuncture today, and I'm so excited. um, Self-care. But yeah, you make a good point about that, because I do have people who, I mean, literally the only time they're leaving the house is coming to see me.
Yeah.
Uh, and, maybe going to a grocery store, but a lot of, my patients are getting everything delivered. They're
Mm-hmm.
not leaving the house. And whether it's, a house call that I'm doing, or they're, coming to me in office, that's the only human contact that they're
Mm-hmm.
really having. And it is different, having gloves and a mask on. And, there's a lot of, like, I don't want to say things missing, but like workarounds that you have to do.
Mm-hmm.
And even in the way that we're scheduling patients, like,
Oh, yeah.
I have to leave more time in between people, because I don't want people having contact in the waiting room. And
Yeah.
even those moments, for people to be able to talk to someone at the front desk, or to talk to someone in the waiting room, just see another human and both get coffee or tea, like those interactions aren't happening too.
Right.
So I'm wondering, what like long-term implications this has too, beyond our practices.
Mm-hmm.
It's weird when you see more than a couple people together now.
Right.
So that translate to, being more social again, like having human connection again. I think it's like great that we can do this. And I think that will, continue. But like you said, like to have human touch, like there's an incredibly therapeutic element to that
Mm-hmm.
people are missing out on now. And I wonder, how much that's going to change going forward too.
Right. I I hear a lot of people talk about going back to normal, and I think you and I would both agree, and I think many people are starting to realize that we're going to have a new normal. I don't think it will ever be what it was 2, 3, 4, 5, 6 months ago before all of this started to unfold. And, you know, I remember seeing photos of people from China years ago who would just be walking around their city with a mask on and think they were silly. And I think that is going to be the norm all across the planet now, that when we go to the grocery store, we will have on masks. I know for myself, and my husband laughs at me every time I go grocery shop, and I'm the one that's mostly going out and doing stuff because I feel like I'm most exposed. We might as well
Right.
keep that way, I guess. So when I go to the grocery store, I have a full N95 mask on. I have gloves. As soon as I get home, anything that I've touched, I wipe it down and disinfect it. And he's constantly making fun of me for this, but the thing is, I'm not necessarily protecting myself. I'm always thinking about protecting those people that I interact with in the office. And granted, the majority of my patients coming in now are not um, very immune compromised, because the ones that are highly immune compromised are staying home. But there will come a time where my autoimmune patients are going to be coming back in and on a regular basis, and I need to make sure that I have the proper barrier protection to make sure that they're safe. And I think you're right. People aren't going to be interacting in the lobby quite as much as they were before. And now, like, I have my practice set up at the moment, and it's really hard for me to figure out when to schedule people because I'm blocking 15 minutes in between. So that I
Right.
expect, and that, early birds and late birds aren't going to be crossing each other in the hallway. And it's hard for me to schedule people now, and I'm looking forward to, like, oh, I can't wait until I can have a 10 o'clock and an 11 o'clock and a 12
Yeah.
o'clock. But that may never come. It might always be that way, that we have limited patients in the office. People don't want to interact. I have patients who sit down in the parking lot and text me at their appointment time and say, can I come up? Like, I would say 90% of my patients coming in these days are checking in with me to see if
Before
nobody's
they
there before they even come in. So I'm pretty sure that's going to be the new normal going forward.
Yeah, because I think it's just like it's starting to embed in people's minds and their behaviors how they need to adjust. And it is
Right.
going to be a level of normal. It won't be like, oh, we're back to normal.
Mm-hmm.
And like there's been like too much trauma, too many things ingrained in us that are like you have to pay attention to these things. And I think what you said about being mindful of who you're coming in contact with, like I'm the same way. So it's like I normally when I treat, I'm like dressed. I wear like business attire and a lab coat. And like I'm probably wearing heels. I don't even know if my feet know how to wear heels anymore because I'm wearing scrubs, because it's just easier. It's easier to, as soon as you walk in the door, strip them off
Mm-hmm.
and get them cleaned. It's, easier to like leave the tennis shoes at the door.
Mm-hmm.
And so all of those are things that, we didn't have to think about before. I already washed my hands 35 times a day. Like that's not a new thing, paying attention to everything being clean. That's not a new thing, but like doing these things in front of patients so that
Mm-hmm.
they see how clean everything is.
Right.
um, making those adjustments in office so that everyone can feel comfortable, that's certainly something that has changed. And I think, for those who aren't coming in, knowing that there's the option for telemedicine, but also like, are you giving anyone who's, not regularly coming in, like some good things that they should just be doing at home? Like some good takeaways that we can give also people who are watching, just, to stay in good health and keep their sanity.
Yeah, absolutely. So a lot of what I'm recommending for people, whether it's things that they can do absolutely free, just because I know I don't think any of us can comprehend the economic impact of this whole situation. So I know everybody's like on different spectrums, whatever their financial situation. So there's a lot of free options I've been offering to people. I did a free meditation training a couple weeks ago, and there's so many resources out there for that. And then something that I've personally been using is tapping, EFT tapping. I don't know if you're familiar with it or if your followers are, but look up EFT tapping. It's emotional freedom technique. There's a guy named Nick Ortner. He's kind of like the guru of it these days, but there's all sorts of stuff. I know on his Facebook page, he does free lives all the time. And then they have an app as well, which I know when kind of COVID hit the United States, they were offering their premium subscription for free. I don't know if they're still doing that. Um, those are great resources that I've been recommending to people. I will be out this week um, to my list of people. I'm going to do a free like hypnosis relaxation on Zoom this week. And then other resources, things that I've been recommending for people from the get-go is to get some moxa. I love the stick-on moxa.
Mm-hmm.
And I created a video on how to find 2 points on the body to help boost the immune system using moxa. And so they can get the stick
Okay.
on moxa and do that at home. And I've gotten incredible feedback from people. They're loving the moxa. They love the way it smells. Um, and which now my office is just eternally smelling like moxa because every patient gets it these days.
Yeah.
And um, yeah, I have people walk in, especially the ones that are doing the moxa at home, and they come in and they go, "Oh, you were doing moxa." They recognize it. So um, those are some great options that people can do anywhere, anytime, and most of them are free. And even just find yin tong, that point right in between your eyebrows, and just rub that, rub it until it's sore, and that'll calm you down.
I've been so pleasantly surprised with how effective acupressure has been in virtual
Yeah.
sessions. I it was totally something I was hesitant about,
Mm-hmm.
because I love needles, and we're called acupuncturists, but we have this enormous scope of practice of things that, often fall by the wayside. I know you and I both do a lot of nutrition and herbs and lifestyle coaching, but a lot of practitioners are like, no, I'm all about the needle. Like, that's what I do. And it's a harder pivot. But I think it's really cool because people are getting introduced to other aspects
Mm-hmm.
of our medicine that are so helpful. And really, it should all be in the standard of care. It should, everyone should have access to it. So that's what I've been really pleasantly surprised by. And I've been just like, for, people who aren't coming in consistently or who aren't able to do, virtual sessions, who just like need good take homes. It's like mastering the basics right now. Like our bodies, like just like keeping stress at a minimum. I keep telling people, like, own your first and last half hour of your day. Like, if you learn how to do that, whether it's like, I do no screens for first and last half hour of the day. I, drink water first thing in the morning. I make my to-do list for the day or journal a little bit. But really owning that first and last half hour. The day itself sometimes will get a little chaotic, but that's okay if your like wake up routine and your wind down routine are on point. And you're managing your stress, like, can go for a walk. Here in Beverly Hills, we're required to wear masks when we leave the house, but it's still a walk outside. It's still like vitamin D, which is amazing for the immune system. So these like very basic things that, we often overcomplicate everything. And it's like, what 50 supplements can I take? And like, what blood work needs to be done? And yes, like I do work like that in my practice. We can get highly specific and we can optimize, but right now is such an amazing time to master the basics at home, and really, own like what's going into your sensory input, like what things
Mm-hmm.
are you exposing yourself to, because we have such amazing control over our environments right now. So
Yeah, I love that. I love I own the first and last 30. I don't advocate this much with my patients. I don't know why, but in all of my hypnotherapy training that I've done over the last 18 months, and I just got certified. Woohoo!
Ooh,
So they talk about like our brain waves are still in that theta state, that highly suggestible state, the first and last 30 minutes of the day. So 30 minutes after waking and in the 30 minutes before you get into deep sleep, that state where you're kind of like in and out dozing into sleep, the 30 minutes before, where our brain waves are highly suggestible. And so if you're we call it the magic 30, but if you're putting in garbage, if you're watching, traumatic news stories or reading about the news or anything like that, like that's just direct beeline to your subconscious. And so I love that idea of, taking time, journaling, getting water, getting proper nutrition into your body the first and last 30 minutes. And that could be food nutrition or it could be mental nutrition. So, feeding your brain the, wonderful, beautiful, positive things in that first and last 30 minutes. And you're absolutely right. That simple change could just change somebody's life.
That's usually like the first, like when I give a new patient homework, it's usually like establishing a wind down routine as part of like that first week. And it's amazing to me, like how transformative that gets for people beyond just like having better sleep. Like they're like, oh my gosh, like how did this little change so much? And we all have an incredible opportunity to do that right now. So it's something that you don't else for. But this has been so fun, Sharleen. It's been great chatting with you. I'll save this to stories, so anybody who missed it, who was not up early on a Monday morning with our weird schedules, will be able to rewatch it. But any last words? Anything else you want to share? I feel like you've given so much, but how do people find you?
Yeah, people can find me at empire.acupuncture on Instagram. I'm on Facebook as well. And I am doing virtual stuff. So, if you aren't leaving the house, hit me up and I'm happy to help. And I love giving free advice. I'm open to that as well. So, um, if I could leave anybody with anything, it's just every day take some breaths and remember who you are.
Oh, I love that. And this is a time to grow who you are.
Yeah, yes. And reconnect with who we are.
Oh, that's the perfect all encompassing. Reconnecting with who we are. All right. Well, thank you, Sharleen, Empire Acupuncture, and be well with Dr. Nell. Thank you so much for joining, and we'll talk soon.
Bye now.